Well, hello. And I know all the stuff you've read. I know The Economist says, I know the Financial Times says that after 2 hours of being on a video conference, it's impossible to maintain attention. This is not true. You're going to find the next 40 minutes really, really interesting. So I do encourage you to stay with it, keep your eyeballs open and focused on the screen, stretch if you need to. This is going to be a wrap-up panel because we're going to talk about governance. We're going to talk about how to make sure that all of the things we've been talking about this afternoon, all of these aspirations, all of these innovative models of investing, these ways of protecting the environment, how to make sure they're actually done and how they integrate with the kind of governance structures that we all live under in the world. So it's going to be a fascinating session. We very much hope you'll take part in the discussion. Look forward to your comments and to your questions. The Slido poll, really interesting. I think you all saw the word map just before it jumped off. But to me, what was interesting is there were so many positives there: hopeful, necessary, finally, someone put with an exclamation mark. But there were also a lot of skeptical remarks there. So skeptical itself, complicated, somebody said, trendy, which probably wasn't positive. Reactionary, somebody else said. So I think in this panel, we shall try to tell you how we can avoid being reactionary and trendy and form-filling and actually fulfill a social need. And I'm joined by three wonderful guests. So Craig Arnold, who is the Vice President of UPS Healthcare Global. And we're going to start with Craig in just a second and talk about what they've been doing to get vaccines and other responses to the COVID pandemic to countries that need them. Claudia Carravetta, who is the Vice President, Corporate Responsibility and Global Philanthropy at AbbVie. And Claudia is going to talk about the evolution of corporate responsibility. And then Jane Nelson, who is Director of the Corporate Responsibility Initiative at the Kennedy School at Harvard, and a non-resident senior fellow at the Brookings Institution, is going to interact with the two of them, as a good skeptical academic should, and ask the difficult questions that, yes, we all remember professors asking us at university. And then we're going to talk about how to map all of this and how to look at ESG as one coherent model. So I think you'll see that the only challenge is how to fit it in 40 minutes. Craig, the UPS Foundation has been right at the forefront of the response to COVID. And we were talking in the green room a bit earlier about the misconceptions that there were and how the experience of delivering vaccines has taught us that some things that looked impossible actually aren't. Tell us a bit about how the UPS Foundation's been doing that.
Thanks, Mark. And on behalf of Claudia and Jane, thanks very much for inviting us. I'm sure this will be, as you said, hard to fit everything in 40 minutes. To answer your question, from the beginning, it appeared to be, despite the best of intentions of many people, a lot of people probably on this call, that equitable distribution was going to be a significant challenge. And that continues today. We see it resulted in cases as well as vaccines. If you look at distribution globally, we're right about 930 million doses delivered of COVID vaccine, and so far only 44 million doses have been delivered into the 92 LMIC countries. So 44 million of 930, that is anything but equitable for those 92 countries. So in terms of governance, I would say that the intentions were right, absolutely, a lot of good intentions. If we hold ourselves accountable and we really look at the transparency and we really look at the numbers, we're failing in terms of equitable distribution. So as a partner in the healthcare system globally, UPS really looked at how can we help? How can we change that trajectory of equitable distribution? And we committed to advancing equitable doses or equitable distribution of doses of COVID vaccine into specific countries where we knew that we could have an immediate impact. And we're doing that really in three ways. One is with loaned executives who are helping ministries of health as well as other vaccine producers and other NGOs in thinking through the supply chain and what are the limiting factors in the supply chain to getting distribution to be quicker and more equitable. The second thing is we're providing gift in kind transportation. Sometimes it just comes down to we just need to be able to produce and help people with the cost of getting things done. And then the third thing, which is something that I don't think 18 months ago we would have even had on our radar, and that is we're providing countries with portable freezers that are ultra cold. They go from -20 down to -80°C. So you can use for Moderna vaccine, but Pfizer is really where we've seen more of these portable freezers being used. They're manufactured by Sterling. We buy them and provide them at cost to people who want to buy them, but we're providing them gift in kind to 9 different countries. And what our message with the freezers and what we're trying to learn, as well as advance immediate equitable distribution, is this initial thought of ultra cold being nearly impossible for the developing world, because there was this thought that we have to have these massive freezer farms that can store tens of millions of doses at a time, like we have in the US and like we have in Western Europe. That's really not A, feasible, or B, necessary to get equitable distribution. What probably works much better than in thinking in terms of very large movements of vaccines at one time is a more constant stream of smaller shipments that can be managed on the receiving end. So on the receiving end, in a developing country, you need to have not only the medical personnel to deliver the doses, but you also need to have a supply chain to move distribution across countries. But you also need storage for those vaccines. Even if it's just for a week, you need storage. So these portable freezers that we're using right now as gift in kind in these 9 countries is really used to put in place and say, listen, you bring in what you can handle in a week. And if you've got some stand-up freezers that can take 5 times, 6 times as many as the portable freezers, that's great. That'll help in a capital city. In your rural areas, let's use these portable freezers. We'll take what can come in, and there's about a 1-for-1 relationship in the Pfizer between a soft box and one of these portable freezers. It's almost exactly 1-for-1. So I can take vaccine, immediately put into the arm where I can. If not, put it into the freezer. It goes from 110 to 240 volts. I can also plug it into a car battery if I need to. So I can use it in that location until I don't need it anymore. And then that might be 2 or 3 rounds of replenishment, or I can then move it to another location and move with my medical staff in those portable freezers. We think that's a game changer in terms of getting equitable distribution. That, along with the loan executives and the gift in kind transportation, is the response we've been taking. Globally, I think as part of the overall system, we need to just think differently. We need to not be stuck around these ideas of massive distributions, because it's a more just in time and a more agile supply chain is probably better.
But Craig, so I maybe I'm the only person. No, I know I'm not. But I was certainly one of the people who said, this is ridiculous. It's cloud cuckoo land. How are you going to deliver ultra cold vaccines when we can't even deliver OPV? And you've learned, maybe you knew it all along, but you've learned up front that actually it's possible. And then you said you've loaned executives and you've helped governments to set up the distribution systems within the country. And that's a learning that applies well beyond COVID. All of that, I know UPS Foundation goes into this with a wholly charitable instinct, and you have your own staff, but all of that creates a set of corporate learning at UPS, doesn't it? That is useful to the core business. Isn't that?
Yeah, absolutely.
Right?
Yeah, I'll give you a great example of some corporate learning that came from a gift in kind program. We helped finance the startup of Zipline, which is a drone provider of medical delivery, originally in Rwanda, and then later we helped finance the expansion into Ghana, and now they're expanding into more and more countries. When that was absolutely a gift in kind approach run through the foundation, but what we learned from that is, and this is 5-6 years ago, but what we learned from that is that for extremely urgent medical supplies, here's a very good, low impact, sustainable solution that speeds past rained out, muddy roads, that speeds past traffic jams, that speeds past poor infrastructure, and can get vaccine in I'll use the example of Rwanda, to 80% of the population in an hour or less, where prior to that, some of these outer villages were a 6-7 hour motorcycle journey, and in the rainy season, maybe even risk not happening. And so now that learning is part of the strategy that UPS has in a whole new business unit called Flight Forward, which is a commercial part of UPS, but that was a learning from the Gift in Kind experience. And also now we're partnered again with Zipline in Ghana, delivering COVID vaccine to so far about 25,000 people in rural villages. So we're working again with them as a partner to do things that can help advance equitable distribution in areas that are very hard to get to.
And Jane, it seems to me that's, as an amateur, it sounds to me fair. It sounds to me like companies that are doing right and learn stuff that's useful along the way for their core business. That's good because it encourages other companies to do the right thing and learn. But is there more to it than that, or is it that simple?
I mean, it's both that simple, and it's also that it requires really, I think, rigorous governance and leadership models. So I think from the perspective, it's that simple. To me, it's absolutely crucial that companies don't think, well, it's just philanthropy or it's just the core business. It's both, and we've got two great examples on the panel today where you've got a spectrum of engagement that that companies can use from, I sort of say, their philanthropy, obviously their core business, their policy engagement, their policy dialogue. And it's, to me, the governance and the leadership challenges, how does one coordinate those and optimize those to have, the biggest impact for people and the planet if there's an environmental perspective, and the impact and integrity for the business. And I think, sort of two key themes that come out from what Craig's just said is, one, just how incredibly important corporate foundations or funds or social impact teams are that are separate from the business, but are still governed by executives in the business and sometimes external executives, and are able to draw on the business. So the example of, loaned executives, in-kind giving, etc. One very important thing they draw from the business is the integrity of global companies' compliance, integrity, audit oversight mechanisms. So that they're operating with that level of integrity, but with a purely and publicly committed social purpose. And so I think it's a really interesting governance mechanism, which draws from the core capabilities and networks of the business that are separate from, and then, as Craig gave us a wonderful example, can share lessons back with the business that can then be potentially scaled and commercialized. So I think it's a great it's a model from a governance perspective. And then secondly, Craig's sort of comments about technology and this idea of sort of distributed technology, and how can we use digital technology, other types of biotech and life sciences tech in a very distributed way, where the scale is massive in terms of the R&D and the innovation that companies are putting in, but the delivery and the implementation can be very localized and done in small amounts but in large numbers. So I think sort of two of the very important contributions that that companies are making, illustrated in that example.
Yeah, it kind of picks up on what Carmen was talking about in the last panel, making sure that companies like UPS, with this global infrastructure, these global capabilities, this global understanding, can support local entrepreneurial responses to local situations. Yeah. And Claudia, I mean, that's very much a part of the evolution of corporate responsibility, right? On the last panel, they were saying, we used to just think it was about giving grants, but there's been this evolution that Craig's really embodied here, and that I know you've taken on board at AbbVie, from saying we don't just give out money to people who look worthy. We actually try to put the talents of the corporation to work, and this has been speeded up by COVID and this kind of strategic and dynamic way of doing corporate responsibility. Tell us how that plays with shareholders. Is it a drag, or does it help them understand the strength of the business?
Yeah, thank you, Mark. And I do just want to take a second just to thank you for the opportunity to be here. I joined the corporate responsibility and global philanthropy team here at AbbVie just about 7 months ago. This is my first PQMD Global Health Policy Forum. It's wonderful to be here and having this very important conversation, very timely conversation. So just to your question, Mark, a couple of thoughts. So just to your point, I mean, obviously companies are evolving beyond this kind of traditional thinking about corporate responsibility. What I would say is that what used to be perceived as just philanthropic activities, to your point, companies are really now looking through this more strategic and dynamic lens, I think, of ESG. So when I think about today's CR or corporate responsibility, it's really about understanding those material ESG risks and opportunities for a company, and not just that, but I think to what Craig was speaking to, how a company is anticipating, managing, and addressing these risks and opportunities to ensure long-term sustainability of the company. So when you think about this in the context of shareholders and investors, this is really critical, largely because it provides a much more holistic view into the company beyond just financial performance. It's really about all sorts of aspects that the company is taking action on, those purposeful and I think responsible actions that really is helping to create value for investors, but also for communities, for, in our case, as pharma, for patients, and for employees as well. And I think why this is so important, I think this holistic view is really helping to see where the opportunities are from an external stakeholder perspective, to understand how their perceptions, their expectations, and I think even the actions they take with regards to our company and just corporations more broadly, how that should evolve and how that increasingly becomes critical to future interactions. And so I think there's really an opportunity here as companies communicate, engage, and just take action more generally. I think there's shareholders are seeing the value of that from both an opportunity perspective for the business, but also from a risk mitigation perspective. I mean, when I think of the G in ESG, I think, just to a point, I think you posted something about this on LinkedIn. It's probably what is perceived as kind of the dullest aspect of ESG, not potentially as trendy as the E and the S. But what I think it's so important about the governance aspect is that it's really critical to every aspect of the company. It's really about what is the quality of a company's management systems in a traditional sense, but the controls and on policies that are in place that really govern how a company operates and how it will take action in whether it's a crisis like a global pandemic, but just along a number of different dimensions of risk and opportunity, which makes it quite a dynamic and important area when we think about that creation of value to a multitude of different stakeholders. I think it's also really interesting in the broader context. Governance is beyond just kind of what a company has in place from a governance perspective and how it's kind of managing risk and leveraging opportunities. But I also think the broader ecosystem around ESG externally and the governance that has now been created and is evolving is, I think, equally as interesting and important. So these frameworks and standards that help to inform and evaluate and provide an actionable view of a company's ESG performance and impact, I think is so fundamental for us to understand, unpack, provide disclosure and report against. But I think it's even beyond that. It's about, this ecosystem also includes the types of partnerships and alliances, these multi-stakeholder engagements that really help us collectively achieve ESG goals. And I think that's really important. And I don't think there's a better example than the most recent example, which Craig talked about in the context of COVID. But what companies are doing along these actions that they're taking in the context of the pandemic really bring to life how sound governance, sound management of risk really helps to position a company and the capabilities of the company in a way that allow them to respond quickly and in an effective way to both the needs of its business, but also the needs of society at such a critical juncture.
No, and Chris, I mean, Christine was saying from an investor perspective on the last panel, exactly that it gives investors reassurance that the company is robust enough in its planning and in its response mechanisms to cope with things. But I was struck by something you just said, Claudia, that these kind of new partnerships. Mohammed Ali Pate tomorrow morning is going to talk about network governance, where you have not-for-profits like many of the PQMD members, for-profit companies, governments, all working together for a similar goal, as Craig was talking about. That does, though, really then ties what Jane was talking about, the need for integrity and the need for transparency, doesn't it? Because you can see how, with a slight shift, that goes from a network governance model to a kind of cronyism, right?
Yeah, I mean, I'm sure Jane has really important thoughts on this. I would say, though, I think you're exactly right. And I think what's so particularly important about governance, and I think in the context for AbbVie, I would say, I can speak from our point of view, the way we innovate, the way we conduct our business is always with a level of integrity and intention to advance our long-term business resiliency, but also, more importantly, the long-term health of the patients that we serve. And so it has to be through that lens of operating with integrity and intention that allows us and showing the value of doing so, which we do day in and day out, that really helps to reinforce the criticality around governance and why investors and other stakeholders across the external environment should have a level of visibility into these actions that are taken. So there's trust in the process and the approach that's being taken. And I think also trust that as a company that is, that has 47,000 employees, that is, we feel a responsibility to those employees. We feel a responsibility to patients, to obviously to investors as well, that we're operating in an environment where we're preparing for the future. We have an operating model that is sustainable and agile, and that can meet the needs of this dynamic environment, and doing it in a way that is with the intent to serve society and our business in the most purposeful way possible, and with that level of integrity that reinforces the trust that our stakeholders have in us.
Jane, I'm going to ask you to comment on that in just a second. Patricia Bakuras has a question, which I'm going to put to Craig in a minute. But if you have questions or comments, we'd like to see them in the chat box very much. So seize the opportunity while you can. So Jane, the criticality of this integrity, this transparency, what does it look like? How do we give reassurance to society that Craig and Claudia and the government of Rwanda are working together in a way that is, what was the phrase you used, Claudia? Purposeful, right? You said
yes. Yeah. No, and I think, to me, there's sort of 5 key things that every company should be doing, and Claudia has sort of really highlighted all of them in different ways. And I'm actually using a framework that the World Economic Forum developed with the 4 global accounting firms around governance. And the first is clarity of governing purpose. So that purposeful, and the company being really clear as a company across the entire company what its purpose is as a business, and having some sort of social impact element linked with that purpose. Secondly, then, the quality of the governing body, so i.e. the board of directors, and clearly, we're seeing, I think, some of the most exciting developments happening in this whole field is how boards of directors are now, setting up committees. AbbVie has, it's always, I think, had a public policy committee, but that committee is now looking at ESG issues as well as regulations and public policy. So many companies are setting up specialized committees, bringing on board directors, obviously just more diversity generally at the board level, but also bringing on directors with sustainability or ESG experience. Claudia's point about the rigor of the policies and processes and the oversight mechanisms in place. So that sort of quality of the governing body is, I think, a second, sort of key thing. Thirdly are the sort of the mechanisms for stakeholder engagement. And both Craig and Claudia have given great examples of being really intentional about identifying the key stakeholders and then what's material or salient to those different stakeholder groups, and putting the metrics in place, not just from the company's perspective, but from what really matters to the stakeholders, and having mechanisms, with employees, with with patients, with consumers, with community partners on how that's done. Very transparent lobbying and government stakeholders. Fourth is that ethical behavior, compliance systems, having having those oversight systems in place, and then I think. Finally, really importantly, and Claudia touched on this, is looking at both risk and opportunity. They're two sides of the same coin. And I think, we need to think of ESG about, yes, what I would call mitigating shared risks to the company and to people and the planet, creating shared value or opportunity for the company and people and the planet. And then if you do those two things right, I think you're building the shared trust that Claudia said is so important. So I think those sort of, 5 areas of having a very clear governing purpose, the rigor of the governing body, both the board and the management team, the sort of stakeholder, very intentional stakeholder engagement mechanisms, sort of rigor of those sort of policies and integrity and ethics programs, and then that dualistically looking at mitigating shared risk and creating shared value in order to build shared trust. And I think if companies are doing that, then investors are going to look at them and say, this is a governance framework, that is strong and credible.
And actually, Claudia, just before I come on to the question, sorry, Craig, go ahead.
Yeah, Mark, I was just going to comment on that, on the first point that you made about the purpose, right? Something amazing happened. I've been at UPS for 34 years. I've never seen anything move as fast as this internal index. We measure, as you can imagine, everything from how many seconds it takes to do something to everyone's feeling about how it worked. Our internal employee engagement survey is something that we measure and have measured for years, and we constantly have campaigns and efforts to drive our engagement index up, as you would expect, right? At the start of the pandemic, it happened to coincide with a change in our leadership, and one of the first things our new CEO did is she redefined our purpose statement, and these are exact words: moving our world forward by delivering what matters. That's the purpose statement that she put out for our entire organization. The employee engagement index from the start of the pandemic to today has seen the largest single increase ever in our company's history. And it's not because the job got easier. In fact, the jobs got harder. People are working longer hours, doing a lot more difficult things, and getting it done at an extremely high level of quality. And that happened in a time of extreme crisis because people feel like they're part of the solution. Mm-hmm. And in fact, that's become almost like a virtual high five message that goes out to people when they do something and they're part of something that works really well. You're part of driving the solution. And that's taken hold with our people. And it's a different sense of employee engagement, that improvement that I've ever seen in our history in the time I've been around. Despite all the efforts of cookouts and pats on the back and ribbons and balloons, it's about people being aligned to the purpose, and it's never been more salient than it is today.
Oh, sorry. So Mark, I just want to add to that. I think that's such a critical point and so fundamental to this concept of ESG. And I think this is what moves kind of these traditional ideas or perceptions of corporate responsibility and philanthropy being, that's what makes a company a good corporate citizen, to something that is much more connected to the broader enterprise and what we're delivering day in and day out as a business. And so this idea of anchoring to your purpose, but also your capabilities, your expertise of your employees, the talent of your employees to deliver on solutions for the business and for broader society. Again, going back to a COVID example, I can tell you from AbbVie, when we took our how do we want want to approach this pandemic? What can we contribute? How do we contribute to the solution? We looked at it from all angles. The first being, how do we show up for our employees, and the health and safety of our employees, fundamental, because the business will not run if our employees are not taken care of. And I think thinking holistically about what do we need to make sure our employees are safe, are healthy, have relief from the stress of even childcare. I mean, we provided childcare relief, to support our employees so they could have that sense of, during an extremely unsettling time, a sense of comfort if they are coming to work and relieving that stress. But then how do we think about our R&D? Do we have products that are on market or in our pipeline that we can think about contributing to testing, experimental testing, joining these research partnerships to see if, a drug as old as Kaletra for HIV, how could it be tested to potentially use as a treatment for COVID? And from an R&D perspective, bringing that expertise and those capabilities, and even thinking from a manufacturing perspective, how do we think about maybe providing our manufacturing capability to help support testing abilities, to help support even viral transport mediums and things like this, which we're in need. And then I think finally, just thinking about our supply chain, our commitment to the patients we serve is the continuity of supply of medicines. And that is our number one concern through the pandemic, and ensuring that we have the governance in place, the scenario planning, the anticipation of how to manage crises, so we could navigate this without supply shortage, without any patient losing access to their treatment and getting their treatments despite global shutdown. It brings to life how fundamental the ESG, how it's all connected to what we do on a day in and day out basis, and how that work, to Craig's point, which is so important, how that ultimately connects to our mission and our business purpose. And I just think that's something that it's really the finer point on ESG. It is just one example, but that's really what it's all about.
And our own sense of purpose, right? To your point about governance, Claudia, our little consulting businesses here, we were cursing a few years ago when a client said to us, "You have to prove that you're pandemic ready." I can't begin to tell you the unkind things we said about that client. And now every day I give thanks for them. It's just it's amazing. So 2 questions for you, Craig. First of all, Patricia, kudos to UPS for your global support. Where are the vaccines coming from that you're delivering? Because she understood that manufacturers are not donating at this time. So maybe you can talk about how it ties to COVAX and the other efforts.
Yeah. So there's 3 different avenues for securing vaccine for countries. It's a bilateral purchase, and sometimes those are commercial. Sometimes they're funded through, as an example, the Asia Development Bank lending interest-free to countries who are then buying the vaccine directly from a manufacturer. We're providing the foundation side of the response. We're providing gift-in-kind transportation, but not gift-in-kind purchase of the vaccine. So they're buying the vaccine. Then there's COVAX shipments, which are going and being allotted by COVAX. In that mechanism, there is still Pfizer vaccine in the COVAX mechanism that's moving. And although AstraZeneca, 336 million of the 337.2 million doses in wave 1 of this was AstraZeneca, that has been largely stalled in the last 4 or 5 weeks. However, Pfizer vaccine is still flowing as part of COVAX, and we're carrying a chunk of it. The last option is, or the last place is where NGOs are now starting to procure vaccine directly, and that's the humanitarian buffer is what we're calling it in the community. That's a very interesting place, and it's just started, really. We're starting to see that ramp up where NGOs are buying considerable amounts of vaccine from those who are still producing, Moderna and Pfizer in particular, and moving those vaccines on behalf of countries. So that those are also areas where we're able to provide gift-in-kind transportation. That second question about the CEO purpose statement, that's a total UPS, commercial UPS branded approach to doing business. The foundation obviously fits beautifully into that. And the foundation's purpose has always been to develop, not only to help those who need a hand up, not necessarily a hand out, but also building capacity, right? And in our area of expertise, building capacity means how do we help people do better with cutting edge supply chain expertise in areas. And I think of the NGO that I work most closely with, the hardest working, wonderful hearted people, but really no idea how to run a supply chain, and they would tell you that. And so what we do when we come alongside them is we will say, look, let's talk about process, let's talk about structure, let's talk about how you procure your supply chain, how does that work, and just by building that capacity, making them more effective and more efficient and being able to do more.
I hate to cut you off, Craig, but I want to cover, in the 5 minutes we have left, I want to cover with Jane. We've talked a lot about how corporations look at this internally. We've talked about how investors look at this. But let's talk about how national governments and international institutions look at ESG. And Jane, I know you have a framework you use with your students, and I know you don't normally give it in 4 minutes, but that's the challenge.
Okay. Well, Claudia almost sort of gave it for me in terms of talking about that governance ecosystem, because I think, as you say, if you look at the internal governance, it's about the board, it's about the executive team, it's about your employee engagement, other stakeholder engagement driven from the company. The sort of the external ecosystem, to me, there's sort of 4 key components of it. It's public governance and government and UN agencies, it's financial governance and investors, it's civic governance and sort of civil society, and then it's what I'd call collaborative governance, where you've got companies working together with all of the others. And I think we're seeing dramatic shifts in all of those areas. On the public governance side, Claudia already talked about the fact that governments are beginning to mandate ESG reporting, the SEC here and the European Union, etc. So there's the governments putting more either incentives or mandates on companies on ESG, but then the opposite side of that is strengthening public governance. And both AbbVie and UPS are doing are great examples, as are many of the companies and NGOs at PQMD, on how you're strengthening governance capacity in countries, at the national level, at the public health worker level, etc. So public governance, I think, is a two-way street of the public governing the companies, but companies working individually or collectively strengthening governance and governance capacity, whether it's on health or energy or other areas. On the financial governance, I think we've chatted a lot of, but again, I think it is a two-way street in terms of investors making sure that companies do have the systems in place to manage their shared risks and create their shared opportunities, but also companies themselves being investors around a sort of social impact model, often in partnership with financial investors. And I think some of the exciting things we're seeing are some of the big institutional investors beginning to partner with companies on global health issues. On the civic side, again, it's that two-way street, access to medicines initiative, access to nutrition index, other sort of rankings of companies, but also clearly partnering with companies, which is what so many of the humanitarian NGOs do. And this collaborative governance model, I think, is going to be so important. And I had the incredible honor of being involved with PQMD, as you did, Mark, right at the beginning. But the fact that this is sustained over 2 decades now as a collaborative model, bringing together not only the healthcare companies, but the UPSs and hopefully more companies, digital companies as we move forward, with humanitarian organizations, a bit like Net Hope has also done, I think is probably one of the best examples of collaborative governance that there's out there, that has its own governing structure, but still enables each of the participants to do their own thing or to have bilateral partnerships and engagements. So I think companies are operating within that ecosystem of the public, financial, civic, and collaborative governance, and it's very dynamic, constantly evolving. But what PQMD members are doing, both individually and collectively, I think hits all of those different categories of of governance.
In 30 seconds each, where do you see COVID speeding this up, or do you see COVID disrupting this? Just 30 seconds each, if you would. Let me start with you, Claudia, and then come to Craig and Jane.
I think I think maybe both. I mean, I do think in some ways it's COVID has been so disruptive in a lot of ways, disruptive in that kind of, obviously in the pure negative sense of disruption, but also in the sense of just accelerating maybe the ideas and innovations and actions that a company was thinking about, or decisions that a company would be taking, maybe probably brought those forward in a sense because the environment required it. And I think also, I think it's this is the approach, around ESG and the willingness of companies to share and take action, and then share and disclose that action through the governance that's out there of reporting and just publicly. I think COVID also helped to show the value of doing that. I think time and again, and and the lessons learned from that. And so I think it's a bit of both, and I think it's positive.
And Craig, I mean, we can see the speeding up UPS, but what about the disruption bit?
Largely what Claudia said, frustration drives innovation. So we go faster, we solve bigger problems when they're there. And so COVID has definitely been disruptive in very many negative ways. It has also forced innovation, and it has forced us to go fast. We've made decisions to expand things, invest in areas that normally would take years to make. We made them in days. And I think that's been good. It also has been disruptive.
Yeah.
Jane, does that sound like what you're hearing?
Absolutely, and I agree very much with both of those closing comments. And from my side, what COVID has done has put people's lives, as Claudia was saying earlier, their health and their safety, people's livelihoods and their incomes and their jobs, and people's learning. But all people, lives, livelihoods and learning at the heart of the government agenda, the corporate agenda, the civic agenda. And I think it does really, give us something to continue to coordinate and work around, in particular as it comes to the topic of global health. So I'm very much on the hope side of the theme, and innovation driven impact.
Well, listen, thanks to the three of you. It's been fascinating. As predicted, we've scratched the surface, but as Victoria has noted in the chat, we'll continue to have questions and discussions on PQMD's community of practice. And I know, given the interest from PQMD members, we're going to be coming back a lot to ESG over this. But thanks to the three of you. It was a really high energy end to the day.